Hi, my name is Kim Staten. I'm a registered nurse in the Hemet ER department. I'm here to show you how to use restraints and go over the policies that we have in our computer system. First, I'd like to start with why we use restraints, and usually it's with a person that is a danger to himself, unable to understand, not to pull on the lines. A lot of times we'll have IVs going, or we have them on the monitors due to different reasons that we have to monitor them. And this is a way to keep them safe. Safety for them and safe for us in case occasionally there'll be a patient who doesn't want to or unable to control himself. So we'll put the restraints at that time. So in order to find our policy and procedures, look under the policy manager, and that will you'll be able to find all the things that you need in order to comply with our regulations here in this hospital. So we'd like to go over criteria for using the restraints. So one of the things is you need the things that you're going to need. So you're going to need an order for the restraint, and then placement of the restraint. Usually it takes 2 people, and then you'll need document how you use them. So depending on what type of restraint, the reason that you're using the restraint, sometimes they're for a behavioral reason. For the behavioral restraint, you will need the order for the restraint and then some assistance in placing these restraints on them. And we always try to do something that's less restrictive. So if you're able to, we try to talk to the patient, put them closer to the nursing station if we can, like in a chair, and observe them. Have family members that can help. Always try the less restrictive way first. And if that doesn't work, then we go to the restraints. So there are time limits on the order that's placed. There's certain criteria that you need to meet when you go to chart the restraints, and if they're used for behavioral reasons, then you need to chart every 15 minutes, and that requires and there's actually a tab in the Paragon system specifically for restraints, and then it'll prompt you which ones to use each time. So this is very important. You don't want to fall back on this because this is something that is regulated by the state, and that will come back at you if you don't do it correctly. The next part would be, then we try to, once they're in the restraint, we try to figure out how can we get these restraints off. We try to medicate. Medication is something we use in the emergency room. Once we've medicated the patient and they become cooperative, willing to, and able to understand, either they're calmer or they're not trying to pull at their lines and their cords, we attempt to do trial releases. And so we'll release the restraint, and if they're cooperative, we don't need to put them on anymore. That's always the goal. It usually takes 2 people. It has to be the nurse that places the restraints, security, and as if in the ER, they are not allowed to place the restraints. It has to be the emergency room nurse who places the restraints, and we can also get the assistance of the ER tech. They are allowed to hold them in place. So if the security person is there, and they'll hold them in place, and then we'll immediately get them placed on them. So we'll do wrist and ankle restraints, and they're called 4-point restraints. You'll be putting them on the wrists first and then the ankles. You don't want to put the ankles on first, because if they try to get up, you can have a really bad accident. So always put on the wrists first and then the ankles, and with the assistance of the security guards. When you enter a room or you have a patient they bring to you that is you're unable to handle them by yourself, you are able to call what we call Dr. Strong. Dr. Strong, you'll either ask the secretary or another, you just yell it out, Dr. Strong, then you will get that assistance that you need in order to control this person so that they don't harm themselves or others. And then once you get the help to hold the limbs in place and you get the patient stabilized that way, you want to apply the wrist restraints first and then the ankles, because if you put the ankles on first and they were able to get away or get out, they could harm themselves and you'll have more problems. Always the wrist, then the ankles. Okay, so when we are applying the restraints, you want to be sure to put them on properly. I have Ross here who's going to help me give you a little demonstration. Actually, they're very easy to apply. Just put them around the wrist. The Velcro, so that makes it a lot easier. So you do the Velcro first, and then there's another little clip. Turn this so that you can see it. Just clips right in there. And then this piece will clip onto the bed. This one will go on here. You put it on the rail. So what you do, generally you'll put this on the rail, around the rail, and then you'll clamp this on there, and that's what keeps it in place. Very, very important is you want to make sure you can put your fingers underneath there. If you can't do that, it's on too tight, and that's going to be a problem. You'll cut off the circulation. You'll have another injury. Thank you for listening to this presentation about restraints, and if you have any more questions, always can ask your director of your department, or a lot of times another nurse in your own department, or you can also ask the house supervisor. All have very good knowledge on how to apply restraints and what the policy and procedures are. Thank you very much.